In terms of the drug treatments, most people with primary or lifelong premature ejaculation will find that this is what they need, especially as they've tried non-drug treatments which have not worked. Again, this goes back to the medical causes which normally can cause your lifelong premature ejaculation. Now, in terms of medical treatment, you've got antidepressants. So your antidepressants such as your SSRIs are well known to delay ejaculation by increasing the serotonin levels in the brain. Examples of your SSRIs include dapagliflozin, paroxetine, citalopram, escitalopram, sertraline, and fluoxetine. These medications can be taken daily or as an on-demand treatment, i.e. whenever you're about to have sexual intercourse. However, there are pros and cons to using either daily or on-demand. For example, daily is shown to be more effective, whereas on-demand is not as effective, but you might have less side effects than if you took daily treatment. In terms of on-demand treatment, the most ideal SSRI to take, which is actually licensed for premature ejaculation, is called dapagliflozin, which is also known as Prilogy, which is a brand name in several countries. However, it is not approved in other countries, and you might find that you might need to take an alternative to Prilogy. This is a short-acting SSRI. It's usually taken as a 30mg or 60mg dose 1 to 3 hours before intercourse. And it is known that this medication can increase intercourse times or delay ejaculation by up to 3 or 4 times your usual time. So for example, if you're a 1-minute man, you can become an 8 or even a 10-minute man with this medication. Now, in terms of alternative to dapagliflozin, for those who are not able to take it for whatever reason, or if it's not available in your country, the next best option is to take paroxetine, which has been shown by studies to be the most effective SSRI when taken as a daily treatment. This is usually taken as a 20 or 40mg dose with the effects seen within 2 weeks. Now, in terms of the side effects of SSRIs, they can actually reduce sexual libido, which means that you might not have the desire to have sex. They can cause nausea, vomiting, fatigue, sleep disturbance, and all other symptoms. So medication is not always ideal for everyone to take. And some people are a bit worried about taking antidepressants, especially if they do not have any anxiety or depression. So if you're not keen on medication, another option is what we call local anesthetics, which come in the form of numbing gels, sprays and creams. So for example, you've got the Emla cream, which can usually be applied 10 to 20 minutes before intercourse. But you might find that it might reduce the sensation, and it can also numb the insides of your partner as well. So you might find that it reduces the pleasure from intercourse. So what some people do is they actually use condoms, but again, this can reduce sensation. However, numbing gels or creams or even the sprays are effective in men that are very sensitive, i.e. maybe they find that they have increased nerve endings in the glands of the penis, which makes them to ejaculate more quickly than they would want to. And this is quite commonly used before medications are tried. In terms of condoms, you have specially designed condoms which are actually made of thicker latex, or they contain lidocaine, which help to reduce friction and stimulation. So I've got a list of condoms here that you can maybe think of trying, and it can actually increase ejaculation times as up to 13 minutes in some men. I mean, whatever treatment that you do decide to try is knowing what works best for you, and I encourage any man who has any problems with premature ejaculation to seek help. And in a lot of cases, the sooner you begin treatment, the sooner you start to have the better quality of life for you and your partner. Now, I hope you enjoyed this video. If you like this video and you want to see further similar videos, please feel free to share, like and subscribe.